This is a schematic of a suicide crisis episode. It takes a look at how a person might be stable for years and something might leak into their life, and then you begin the crisis process of like building up to like, why am I living? Is this all worth it? I'm worthless. I'm hopeless. There's nothing to live for. This schematic kind of looks at the risk level from 1 to 7 on the left-hand side and tells us that crisis escalates. I think we know that. The important part here is that days, hours, and days at the bottom, the crisis begins, the crisis peaks, and the crisis diminishes. There's a window of time in that 3 weeks where the person peaks and might actually decide to die by suicide. But it's a window, and that's the window we have to prevent from happening. It's not always wanting to die by suicide every day in multiple attempts for most people. It's that one thing that kind of breaks the bow that has people go on to actually attempt to die by suicide. So we need to diminish the crisis in the peak area by having intervention. And that's why I think you're on the call today, and I hope that I can be helpful in giving you some of that information. There's a lot of data about suicide, and you can go to these websites. It's perennially, it's been the 10th leading cause of death in the United States and the second leading cause of death for youth and young adults. The reason for young adults is they usually don't die by heart disease, cancers, etc. So that's why it's so high up for young people, but it's certainly of concern. Being the 10th leading cause is important enough, and you'll see some numbers that actually are quite high, so the intervention becomes critical as to helping people. Another stat here, 90% of the people who die by suicide have a diagnosable mental health issue at the time of death. A lot of times we find that out post-mortem, that they had a condition that wasn't treated properly, or they had a condition that they were being treated for or walked away from the medication or the counseling that they were getting maybe. But the key thing is that often people come into contact with health professionals during the time of their risk. So our radar really should be all important about having those signals about what's going on. And I know when I see my providers, they're asking some seminal questions that are about, how's life going? You doing okay? How's your day to day? Have you ever felt any depression? Those kinds of inquiries that are important to look for signals and then do some follow-up. We never want to miss that when we're seeing our clients or our patients, for sure. Who's in a position to do that? Primary care providers. You can identify people at risk. There's some studies that show that up to about half of the individuals that die by suicide had some contact with a primary care provider in a month before. I think that's very telling. It's a bit of our responsibility to be on alert for this. It is our responsibility. And I don't think we ever want to lose that edge that we want to bring to the patients and the clients that we work with. So this has always got to be one of those things that's in the back of your mind for patients you see regularly or patients you see once a year, maybe, just to ask these questions and be mindful of them. The other thing is that a high statistic that came out of this study back in 2010 was 77% had contact with a primary care provider in the year before their death. So people are going in for help for lots of things. They're seeing you in your capacity as a provider for lots of different reasons, but we always want to be aware of what might be resonating with them, how life is going, how their chronic illnesses are going. Am I feeling better about what's happening in my life? Am I in a position where I don't think about suicide? For sure, we want to make sure they're not thinking about suicide. So we treat mental illness. We encounter patients that have risk factors. We want to really figure out what we do with those patients once we find out that they have risk factors. If we don't have proper education, we don't have awareness on specific skill sets that we can intervene with, you might miss the warning signs and risk factors that indicate a high suicide risk.